There's a seed that has been quietly thriving in the shadow of modern medicine, a seed mentioned in ancient texts, found in the cabinets of traditional healers, and whispered about by cultures for centuries. Today, we're going to uncover what science is finally catching up to. Black seed oil. It's derived from Nigella sativa, a small flowering plant native to Southwest Asia. For thousands of years, black seed oil has been used in herbal medicine, but now we're beginning to understand why. And more importantly, how. At the center of this oil's potency is a bioactive compound called thymoquinone. Thymoquinone is not just another antioxidant. It has a remarkable ability to modulate inflammation, reduce oxidative stress, and impact multiple signaling pathways at the cellular level. We're talking about a substance that influences everything from immune regulation to cancer cell apoptosis. And this is not folklore anymore. Dozens of peer-reviewed studies have begun documenting these effects. Let's start by discussing inflammation, which is at the root of almost every chronic diseasing: heart disease, arthritis, diabetes, even neurodegenerative disorders. Inflammation is a necessary part of healing, but when it becomes chronic, it begins to damage healthy tissue. Thymoquinone has been shown to suppress inflammatory enzymes like Seheult, as well as downregulate key molecules like TNF-alpha and interleukin-6. Staying away from processed food. This is powerful because these are the same inflammatory markers found elevated in autoimmune conditions, obesity-related inflammation, and even Alzheimer's disease. When we talk about chronic diseases, we can't ignore oxidative stress. Oxidative stress is essentially rusting from the inside out. Every cell in your body is under constant attack by free radicals, unstable molecules that damage DNA, proteins, and lipids. Black seed oil's antioxidant capacity rivals that of some of the most well-known natural compounds. Thymoquinone scavenges free radicals and increases the body's production of endogenous antioxidants like glutathione and superoxide dismutase. That means you're not just getting passive protection, you're stimulating your own internal antioxidant system. And this isn't theoretical. Clinical trials have shown that with metabolic syndrome, who took black seed oil daily saw improvements in cholesterol, blood pressure, fasting glucose, and inflammatory markers, all of which are to oxidative stress. Imagine one natural compound impacting every one of those variables without the side effects commonly associated with polypharmacy. But here's what's even more impressive. Black seed oil doesn't just stop damage, it promotes healing. It enhances the activity of macrophages and lymphocytes, which are key players in your immune system. These cells don't just defend, they repair. The oil also appears to influence gene expression, particularly in pathways to cell proliferation and apoptosis. That's especially relevant in cancer research, where thymoquinone has been shown to induce programmed cell death in various cancer cell lines, including breast, colon, pancreatic, and prostate cancers. The liver, your body's detoxification powerhouse, is another organ that benefits from this oil. Studies in animal models show that black seed oil can protect liver tissue from toxin-induced damage, reduce liver enzyme levels, and even promote liver regeneration. This is not insignificant when you consider how many people suffer from non-alcoholic fatty liver disease due to insulin resistance and poor dietary habits. And while we're talking about regeneration, let's not forget its impact on skin health. Topical application of black seed oil has been shown to reduce eczema, acne, and psoriasis symptoms. That's because it not only calms inflammation but also supports the skin's natural barrier function. It hydrates, soothes, and allows damaged tissue to heal from within. So what we have here is not just a trendy superfood. We have a substance that operates on multiple biological levels: anti-inflammatory, antioxidant, immunomodulatory, hepatoprotective, anti-cancer, and skin restorative. And yet, most people still don't know about it. That's the tragedy. But it's also the opportunity, because when you understand the mechanisms, when you look beyond the headlines and into the actual biochemistry, black seed oil emerges not as a miracle cure, but as a legitimate tool in restoring balance to a body that's been under siege by inflammation, toxins, and chronic stress. Thymoquinone is the active powerhouse compound found in black seed oil, derived from the seeds of Nigella sativa. This compound is what gives black seed oil much of its therapeutic potency and unique biochemical effects. When we explore the mechanisms of thymoquinone, we discover a natural molecule that intervenes directly in two of the most critical processes that drive chronic disease: inflammation and oxidative stress. These are not just buzzwords, they represent the physiological dysfunction at the root of nearly every degenerative disease known to modern medicine. Thymoquinone operates at the cellular and molecular level, modulating pathways that can shift the entire state of health in a body that is under chronic assault. This is a compound that can pass through the blood-brain barrier, influence intracellular signaling cascades, and even alter gene expression patterns related to inflammation and immune function. Let's start by understanding the role of inflammation. Acute inflammation is essential for healing. It's the body's immediate response to injury or infection. But chronic inflammation, which is often silent and systemic, is a different story. It's now understood to be a key player in diseases such as heart disease, type 2 diabetes, obesity, autoimmune disorders, and even depression. Thymoquinone has been shown to suppression of pro-inflammatory cytokines such as interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha. These molecules act like accelerators for the inflammatory process, and they are consistently elevated in individuals suffering from chronic illnesses. By downregulating these molecules, Thymoquinone can interrupt progression of inflammatory damage, effectively reducing tissue destruction and dysfunction at the source. Moreover, Thymoquinone interferes with the nuclear factor kappa B NF-κB signaling pathway. This is a critical regulator of inflammation, controlling the transcription of DNA and the production of inflammatory proteins. In chronic disease states, NF-κB is often hyperactivated, leading to a constant state of immune agitation. Thymoquinone inhibits this activation, thus restoring a more balanced immune profile. The inhibition of cyclooxygenase 2-COX-2 an enzyme responsible for producing pro-inflammatory prostaglandins, further contributes to this effect. What's important here is that these actions occur without the gastrointestinal defects that are common with synthetic anti-inflammatory drugs like NSAIDs. That makes Thymoquinone a safer long candidate for managing low-grade inflammation that underpins many of today's health problems. When we examine the effects of black seed oil on metabolic syndrome, we uncover a unique nutritional intervention that impacts some of the most pressing health concerns in modern populations: high blood pressure, insulin resistance, dyslipidemia, and abdominal obesity. These are not isolated issues, but rather interconnected components of a broader systemic dysfunction that accelerates aging and increases the risk of cardiovascular disease, type 2 diabetes, and stroke. The ability of black seed oil, particularly through its active component thymoquinone, to positively influence all these parameters simultaneously is both clinically significant and biochemically remarkable. This isn't a supplement that targets a single symptom. It works upstream, addressing the underlying drivers of metabolic imbalance at the cellular and hormonal levels. One of the primary issues in metabolic syndrome is insulin resistance. Cells become less responsive to insulin, forcing the pancreas to produce more of it in an effort to drive glucose in cells. Over time, this leads to hyperinsulinemia, increased fat storage, and ultimately pancreatic burnout. Black seed oil has been shown in both human and animal studies to improve insulin sensitivity, reduce fasting glucose levels, and lower SHBG, the long-term marker of blood sugar control. The mechanism here involves increased expression of glucose transporter type 4 GLUT4, which facilitates the uptake of glucose into muscle and fat cells in response to insulin. Additionally, black seed oil reduces inflammatory markers like interleukin-6 and TNF-alpha, both of which are known to interfere with insulin receptor signaling. By addressing both the inflammatory burden and the receptor sensitivity, black seed oil helps restore metabolic flexibility. Cholesterol metabolism is another area where black seed oil exerts profound influence. Many people with metabolic syndrome have elevated LDL cholesterol, low HDL cholesterol, and high triglycerides, an atherogenic profile that drives plaque formation and arterial damage. Thymoquinone has been shown to inhibit HMG-CoA reductase, the same enzyme targeted by statin drugs, which results in reduced synthesis of cholesterol in the liver. But unlike statins, Thymoquinone does not impair the production of coenzyme Q10, a vital compound for mitochondrial energy and heart function. This alone gives it an advantage in supporting cardiovascular health, without the common side effects associated with pharmaceutical lipid-lowering agents. Furthermore, studies have shown that black seed oil increases HDL cholesterol, which as a scavenger, removing excess cholesterol from the arteries and transporting it back to the liver for excretion. This dual action, reducing LDL and boosting HDL, shifts the lipid profile in a more protective direction. Blood pressure regulation is a complex process involving vascular tone, sodium balance, kidney function, and endothelial integrity. Black seed oil impacts multiple pathways involved in maintaining optimal blood pressure. It acts as a natural calcium channel blocker, allowing blood vessels to relax and widen, thereby reducing peripheral resistance. In addition, its diuretic properties promote the excretion of excess sodium and water, relieving the burden on the vascular system. Research has shown significant reductions in both systolic and diastolic blood pressure among participants who took black seed oil consistently for several weeks. These effects are not superficial. They reflect deeper improvements in endothelial function, nitric oxide availability, and the reduction of oxidative stress within the vascular lining beyond numbers on a lab report. Metabolic syndrome also manifests as chronic fatigue, brain fog, mood instability, and increased vulnerability to infections. These subjective symptoms often go unaddressed by conventional therapies, yet they are central to the patient's quality of life. Black seed oil supports mitochondrial function, enhances antioxidant defense systems, and reduces systemic inflammation, all of which contribute to improved energy metabolism and cognitive clarity. Inflammation in the brain, particularly in the hypothalamus and hippocampus, has been linked to poor regulation of appetite, sleep, and mood. The anti-inflammatory and neuroprotectants of black seed oil may help rebalance these areas, leading to better overall regulation of hunger cues, satiety, and even emotional resilience. Adipose tissue itself is not inert. It acts as an endocrine organ, releasing pro-inflammatory cytokines and hormones that perpetuate insulin resistance and metabolic dysregulation. Black seed oil appears to alter the function of adipocytes, reducing the secretion of harmful molecules like resistin and leptin while increasing adiponectin, a hormone that enhances insulin sensitivity and fat oxidation. This shift in adipokine profile creates a favorable metabolic environment, facilitating weight loss and improving body composition without the need for extreme dietary restriction. The oil system's ability to modulate gene expression with fat tissue underscores its role as a metabolic regulator rather than a simple nutrient. Even the gut microbiome, which is increasingly recognized as a central player in metabolic health, may be positively influenced by black seed oil. Some studies suggest it helps maintain microbial balance, reducing endotoxins that can leak into the bloodstream and trigger systemic inflammation, a phenomenon known as metabolic endotoxemia. By supporting gut barrier integrity and microbial diversity, black seed oil contributes to the foundational health of the gastrointestinal tract, which in turn affects nutrient absorption, immune function, and hormonal balance. The immune system is a tightly coordinated network of cells, signaling molecules, and organs designed to defend the body against threats while maintaining tolerance to self. When balanced, it allows for rapid responses to infections and efficient resolution of inflammation. However, when this system becomes dysregulated, the consequences are far-reaching. Autoimmune disorders, chronic inflammation, increased susceptibility to infections, and even cancer. Black seed oil, through its principal active compound Thymoquinone, interacts with the immune system on multiple levels, promoting both immune vigilance and immune regulation. It doesn't just stimulate or suppress, it modulates, offering a more intelligent and adaptive influence on immunity that aligns with the body's needs rather than forcing a singular outcome. One of the foundational ways black seed oil supports the immune system is by influencing the activity of key white blood cells, such as macrophages, T lymphocytes, B cells, and natural killer cells. Macrophages serve as the frontline defenders, engulfing pathogens and releasing cytokines to recruit other immune cells. Thymoquinone enhances the phagocytic capacity of macrophages while also modulating the release of inflammatory mediators. This means that the cells become more efficient at clearing invaders without overproducing the inflammatory chemicals that can damage tissues if left unchecked. T cells, which are essential for orchestrating adaptive immunity, also respond favorably to thymoquinone. Studies show that it promotes the proliferation of helper T cells when needed, but also increases regulatory T cells, which act like brakes to prevent autoimmunity and chronic inflammation. Cytokine regulation is one of the most critical elements of immune balance, and this is another area where black seed oil demonstrates its modulatory capacity. Thymoquinone has been shown to downregulate pro-inflammatory cytokines such as interleukin-1T, interleukin-6, and tumor necrosis factor alpha. These molecules are often elevated in autoimmune conditions, allergic responses, and metabolic dysfunctions. At the same time, it can upregulate anti-inflammatory cytokines like interleukin-10, which helps resolve inflammation and promote tissue healing. This balanced approach contrasts with conventional immunosuppressants, which often shut down broad swaths of the immune system, leading to vulnerability to infections and impaired healing. Black seed oil supports a state of immune readiness without tipping the system into overreaction. The influence of black seed oil on gene expression is particularly relevant to immune health. Thymoquinone has epigenetic effects, meaning it can turn certain genes on or off without altering the DNA sequence itself. This is achieved through modifications in histone acetylation and DNA methylation, which affect how tightly DNA is called and which genes are accessible for transcription. Genes involved in inflammation, oxidative stress, and immune signaling are among those most affected. This dynamic regulation enables the body to adapt its immune response to the environment, enhancing defenses when under threat, and dampening inflammation when the threat is past. Natural killer cells, which are specialized in identifying and destroying virally infected and cancerous cells, also benefit from black seed oil. Thymoquinone increases the cytotoxicity of these cells, making them more effective at targeting abnormal cells before they can proliferate. This has implications not only for infectious diseases but also for immune surveillance against tumor formation. In the early stages of cancer development, the immune system often detects and eliminates rogue cells before they form detectable tumors. Enhancing this surveillance system is one of the most promising preventive roles of natural compounds like black seed oil. Black seed oil also has a remarkable ability to support the mucosal immune system, which includes the respiratory and gastrointestinal tracts. These are the first points of contact for pathogens entering the body. The mucosal surfaces are protected by immunoglobulin A, JAK, secreted by B cells in response to microbial threats. Thymoquinone has been shown to stimulate IgA production and support the integrity of the mucosal barrier, especially in the gut. This is significant because many chronic immune disorders originate from increased intestinal permeability, where microbes and toxins leak into the bloodstream and provoke systemic immune activation. By preserving the barrier and supporting IgA secretion, black seed oil strengthens the body's first line of defense. Another notable benefit is the oil's antiviral and antimicrobial properties. While not a replacement for antibiotics for antivirals in acute situations, thymoquinone has demonstrated inhibitory effects on a wide range of pathogens, including bacteria like Helicobacter pylori, viruses such as cytomegalovirus and influenza, and even fungal species like Candida albicans. This broad-spectrum activity means that black seed oil supports the immune system both directly, by assisting in microbial clearance, and indirectly, by modulating the inflammatory response to infection. The oil does not wipe out beneficial bacteria like broad-spectrum antibiotics can, which helps maintain a balanced microbiome. Further supporting immune homeostasis, perhaps most compelling is black seed oil's role in re-educating an immune system that has gone awry. In autoimmune conditions like rheumatoid arthritis, lupus, and multiple sclerosis, the immune system mistakenly targets the body's own tissues. Thymoquinone appears to reduce autobody production and promote immune tolerance, not through broad suppression, but by restoring the balance effector and regulatory immune cells. This nuanced effect provides a safer, long-term strategy for immune modulation without the paralysis seen in stronger pharmacological agents. The liver is one of the most vital organs in the body, responsible for detoxification, nutrient storage, hormone metabolism, bile production, and over 500 other essential biochemical functions. It serves as the body's filtration system, continuously working to neutralize toxins, metabolize medications, break down excess hormones, and convert nutrients into usable forms. In the modern world, however, the liver is under relentless assault from poor diet, alcohol, environmental toxins, sedentary lifestyles, and chronic inflammation. Conditions like non-alcoholic fatty liver disease, hepatitis, and drug-induced liver injury have become increasingly prevalent. Amid this rising burden, black seed emerged as a natural hepatoprotectant with capacity not only to protect liver cells from damage but also to support liver regeneration and optimize its performance at a cellular level. One of the most notable properties of black seed oil is its ability to neutralize oxidative stress in hepatic tissue. The liver's detoxification process inherently generates active oxygen species, especially during the breakdown of alcohol, medications, and environmental chemicals. While the liver has its own antioxidant defense mechanisms, prolonged toxic exposure or underlying metabolic dysfunction can overwhelm these systems, leading to lipid peroxidation, DNA damage, and ultimately hepatocellular injury. Thymoquinone, the principal bioactive compound in black seed oil, acts as a potent antioxidant that directly scavenges free radicals. More importantly, it boosts endogenous antioxidant enzymes such as glutathione peroxidase catalase and superoxide dismutase within liver tissue. These enzymes form the liver's internal defense line, neutralizing oxidative stress before it can inflict lasting damage. Black seed oil has also demonstrated the ability to lower elevated liver enzymes such as ALT alanine transaminases, aspartate transaminases, and ALP's alkaline phosphatase, which are commonly used clinical markers for liver stress or damage. Elevated levels of these enzymes seen are often in patients with fatty liver, hepatitis, or drug-induced liver injury. Several studies involving individuals with liver dysfunction or metabolic syndrome have shown that supplementation with black seed oil can significantly reduce these enzyme levels, indicating an improvement in liver function and a reversal of hepatocellular inflammation. The reduction of inflammatory cytokines like TNF-alpha and interleukin-6 further supports the oil's role in decreasing liver inflammation, a critical factor in halting the progression of fatty liver to cirrhosis. Beyond protecting liver cells from damage, black seed oil actively supports hepatic regeneration. The liver is one of the few organs in the human body capable of regenerating itself after injury. This regenerative capacity, however, can be impaired by chronic inflammation, fibrosis, or excessive toxin load. Black seed oil appears to enhance the expression of growth factors that are vital for cellular repair and proliferation in hepatic tissue. In animal models, administration of thymoquinone following chemically induced liver injury has resulted in accelerated recovery, restored liver architecture, and reduced fibrosis. The suppression of fibrogenic markers like transforming growth factor, beta, TGGT, and collagen deposition further points to black seed oil's antifibrotic potential, which is essential in preventing the hardening and scarring of liver tissue. Lipid metabolism, another core liver function, is profoundly influenced by black seed oil. In cases of non-alcoholic fatty liver disease, excess fat accumulates in hepatocytes, often due to insulin resistance, poor dietary habits, and chronic inflammation. This fat buildup can impair liver function and increase the risk of steatohepatitis and cirrhosis. Thymoquinone has been shown to enhance lipid oxidation and reduce the accumulation of triglycerides within the liver. It does so by modulating the activity of peroxisome proliferator activated receptors (PPAPs), which are nuclear receptors involved in lipid and glucose metabolism. Additionally, black seed oil improves insulin sensitivity, indirectly reducing the insulin-driven fat storage mechanisms that often worsen fatty liver. Another dimension of black seed oil's hepatoprotective effect lies in its ability to modulate phase I and phase I liver enzymes, which are responsible for detoxifying xenobiotics, drugs, and endogenous metabolic waste products. These enzymes help transform fat-soluble toxins into water-soluble compounds that can be safely excreted via the kidneys or bile. An imbalance in these detoxification phases can result in intermediate toxic compounds that are more harmful than the original toxins. Black seed oil helps maintain a balanced detoxification process by ensuring that both phases are functioning efficiently, thereby reducing the risk of toxin accumulation and cellular stress. The gut-liver axis is also an area where black seed oil provides benefits. Increased intestinal permeability or dysbiosis in the gut can allow endotoxins like lipopolysaccharides, LPS, to enter the bloodstream and reach the liver through the portal vein. This triggers a powerful inflammatory response and contributes to liver inflammation and fibrosis. Thymoquinone has been shown to improve gut barrier integrity and reduce systemic levels of LPS, thereby lightening the inflammatory burden on the liver. By supporting a healthier gut microbiome and reducing intestinal leakage, black seed oil indirectly safeguards liver health through this critical two-way communication system between the gut and liver. The antimicrobial and antiviral properties of black seed oil are also relevant in the context of liver health, particularly for viral hepatitis. While not a replacement for antiviral therapies, thymoquinone has shown inhibitory effects on viral replication and supports the immune system's ability to control chronic infections that affect liver tissue. The reduction in liver inflammation and oxidative damage in viral models suggests that black seed oil may serve as an adjunctive tool for individuals managing chronic liver infections. Cancer remains one of the most complex and feared diseases in modern medicine, characterized by uncontrolled cell growth, immune system evasion, angiogenesis, and the ability to metastasize to distant tissues. While conventional treatments such as chemotherapy, radiation, and surgery remain central to cancer care, there is growing recognition that natural compounds may provide supportive roles by targeting the cellular environment in which cancer develops. Black seed oil, and more specifically its active component thymoquinone, has shown promising anti-cancer potential through a variety of mechanisms including pro-apoptotic activity, inhibition of cell proliferation, anti-inflammatory modulation, and the disruption of multiple cancer-promoting signaling pathways. One of the key challenges in cancer is the failure of the body's own natural surveillance system to identify and destroy abnormal cells before they proliferate. Thymoquinone has been shown to enhance activity of tumor suppressor genes such as 53, a master regulator of DNA repair and cell cycle arrest. In many types of cancer, p53 is either mutated or suppressed, allowing damaged cells to replicate unchecked. Thymoquinone reactivates 53 in certain cancer cell lines, restoring its ability to initiate programmed cell death, or apoptosis, which is one of the body's most powerful built-in defenses against tumor formation. In laboratory studies, thymoquinone has demonstrated selective toxicity toward cancer cells while sparing healthy cells, a property rarely seen in conventional chemotherapy agents. Thymoquinone's effect on apoptosis is not limited to p53 activation. It also modulates the expression of pro-apoptotic proteins such as BAX and caspases while downregulating anti-apoptotic proteins like BCL2. This shift in the balance between cell survival and cell death tilts cancer cells towards self-destruction without harming normal tissues. Caspas are enzymes that break down cellular components during apoptosis, and their activation is a clear marker of healthy cellular turnover. This regulation of the intrinsic and extrinsic apoptotic pathways makes thymoquinone an important compound in the realm of integrative oncology. In addition to promoting apoptosis, black seed oil inhibits the proliferation of cancer cells by interfering with the cell cycle. Cancer cells replicate rapidly and often escape the normal checkpoints that control the timing and accuracy of cell division. Thymoquinone induces cell cycle arrest at various phases depending on the cancer type, often at the G1S or G2M transitions where DNA is checked for damage before proceeding. By pausing the cell cycle, thymoquinone gives the body time to repair or remove faulty cells before they can continue dividing. This disruption of replication is especially important in preventing the spread and progression of early-stage tumors. Angiogenesis, the formation of new blood vessels, is another process essential for cancer growth. Tumors require a continuous supply of oxygen and nutrients, and they stimulate angiogenesis to build a blood supply that supports their rapid expansion. Thymoquinone has been shown to downregulate vascular endothelial growth factor (VEGF), a signaling molecule that promotes blood vessel formation. By limiting VEGF expression, black seed oil effectively starves the tumor, preventing it from growing beyond a certain size and limiting its ability to metastasize. In animal models, tumors treated with thymoquinone exhibited reduced vascularization and slower growth compared to untreated controls. Another hallmark of cancer is the chronic inflammatory environment in which it thrives. Inflammation contributes to DNA damage, creates growth signals for tumors, and suppresses immune surveillance. Thymoquinone reduces the expression of inflammatory cytokines and inhibits NFJ-JB signaling, a pathway deeply involved in the promotion of inflammation and cancer progression. NFJB activation is found in many cancer types and is associated with resistance to chemotherapy and radiation. By blocking this pathway, thymoquinone not only impairs cancer cell survival but also makes them more susceptible to standard treatments. This makes it an excellent candidate for combination therapies that seek to reduce drug resistance and improve treatment outcomes. Metastasis, or the spread of cancer to distant organs, is responsible for the majority of cancer-related deaths. This process involves steps including cell detachment, invasion to surrounding tissue, entry into the bloodstream, and colonization of distant organs. Thymoquinone inhibits metastasis by interfering with enzymes like matrix metalloproteinases, MMPs, which degrade the extracellular matrix and allow cancer cells to invade nearby structures. It also modulates adhesion molecules that cancer cells use to anchor themselves in new tissues. These anti-metastatic properties have been observed in several aggressive cancer models, including breast, pancreatic, prostate, and lung cancers. Black seed oil's immunomodulatory properties also contribute to its anticancer effects. An effective immune response is critical in recognizing and eliminating cancer cells. Thymoquinone boosts natural cell activity and enhances the presentation of tumor antigens to immune cells, allowing for more effective identification and clearance of malignancies. This immune stimulation is particularly relevant in cancers that use immune evasion tactics, such as downregulating major histocompatibility comps MHC molecules to avoid detection. Oxidative stress plays a dual role in cancer development. While low levels of reactive oxygen species can promote mutations and tumor growth, high levels can trigger cell death. Thymoquinone balances this dynamic by acting as a pro-oxidant in cancer cells, raising oxidative stress beyond survivable levels and pushing these cells into apoptosis. This selective oxidative stress induction is part of what allows thymoquinone to target cancer cells while leaving normal cells unharmed. Black seed oil has been used for centuries across traditional healing systems for a wide range of ailments, and modern research is now beginning to uncover the mechanisms that make it so effective for supporting health both internally and externally. Its benefits extend far beyond internal biochemistry and cellular modulation. It also plays a significant role in supporting the health of the skin, respiratory system, and gastrointestinal tract. These three areas are not only vital for physical health, but are often the first to show signs of systemic imbalance, inflammation, or immune dysfunction. What makes black seed oil especially unique is its ability to support these systems through both topical and oral use. Offering a comprehensive and multi-pathway approach to healing, the skin is the largest organ of the body and serves as the first line of defense against environmental insults, pathogens, and allergens. It also reflects what is happening internally, particularly in the gut and immune system. Many chronic skin conditions such as eczema, acne, psoriasis, and dermatitis are known to involve immune dysregulation, oxidative stress, and microbial imbalances. Black seed oil, when applied topically, delivers a potent combination of anti-inflammatory, antimicrobial, and antioxidant effects directly to the skin surface. Thymoquinone has been shown to suppress the activity of inflammatory mediators in the skin, reducing redness, swelling, and itching. Its antioxidant properties skin cells from environmental damage caused by UV radiation and pollution, which can accelerate aging and cellular breakdown. Topical use of black seed oil also enhances the skin barrier function by restoring lipids and preventing transepidermal water loss. This makes it particularly effective for dry, cracked, or sensitive skin where the protective barrier has been compromised. Clinical studies have demonstrated improvements in skin hydration, elasticity, and smoothness with regular use of black seed oil-based formulations. Its antibacterial and antifungal properties further help common skin infections such as acne caused by Propionibacterium acnes or fungal overgrowth that contributes to conditions like seborrheic dermatitis. In wound healing, black seed oil has been shown to accelerate tissue repair, reduce scarring, and promote collagen formation, qualities that are essential not only in minor cuts and burns but also in managing post-inflammatory hyperpigmentation and surgical recovery. In the respiratory system, black seed oil acts as both a bronchodilator and anti-inflammatory agent. This dual action makes it useful in managing conditions such as asthma, bronchitis, allergic rhinitis, and chronic obstructive pulmonary disease. Thymoquinone inhibits the release of histamine from mast cells and reduces eosinophilic infiltration in lung tissue, two of the primary mechanisms involved in allergic airway inflammation. This modulation helps to calm hyperreactive airways and decrease the frequency and severity of asthma attacks. Moreover, black seed oil reduces mucus production and supports the clearance of existing mucus from the airways, improving overall breathing capacity for those with chronic coughs or seasonal allergies. Oral supplementation with black seed oil has been shown to reduce nasal congestion, sneezing, and wheezing. Its antispasmodic properties help to relieve the constriction of bronchial muscles, while its antimicrobial effects support the body in clearing respiratory infections more effectively. In individuals suffering from viral infections like the flu or the common cold, black seed oil can reduce symptom duration and intensity by enhancing the immune response and modulating inflammation without overactivation. This is particularly valuable in respiratory illnesses where excessive inflammation can cause more harm than the infection itself. In the digestive system, black seed oil helps regulate gastrointestinal function, reduce inflammation, and restore microbial balance. The gut is the interface between the external world and the internal body, housing more than 70% of the immune system and trillions of microbes that influence everything from metabolism to mood. Black seed oil has been shown to support the health of the intestinal lining, reduce intestinal permeability, and modulate the composition of the microbiota. In conditions like irritable bowel syndrome, inflammatory bowel disease, and leaky gut syndrome, black seed oil exerts a calming effect by reducing pro-inflammatory cytokines and protecting the integrity of the gut wall. Thymoquinone also exerts antispasmodic effects on smooth muscle tissue in the digestive tract, making it effective for reducing cramping, bloating, and abdominal discomfort. For those suffering from indigestion, gastric ulcers, or reflux, black seed oil may help by reducing gastric acid secretion and protecting the mucosal lining of the stomach. Its antimicrobial activity against Helicobacter pylori, the bacteria linked to peptic ulcers and gastric cancer, adds another layer of protection and healing for the gastrointestinal tract. Regular use of black seed oil can promote more efficient digestion, improve nutrient absorption, and support regular bowel movements, all of which are essential for long-term health and vitality in the case of parasitic infections or fungal overgrowth in the gut. Black seed oil offers an additional advantage through its natural antiparasitic and antifungal properties. It has been used traditionally to expel intestinal worms and has shown effectiveness against Candida albicans, a common yeast that can disrupt the microbial balance in the gut when allowed to overgrow. By restoring a healthier microbial terrain, black seed oil not only supports digestion, but also plays a role in mood regulation, immune strength, and hormonal balance due to the deep interconnectedness of the gut-brain immune axis.